The axillary nerve originates from the posterior cord of the brachial plexus. With root contributions from C5 and C6. It courses anterior to the subscapularis muscle and enters the quadrangular space. From there, it divides into two branches. The anterior branch winds around the surgical neck of the humerus to innervate the deltoid, while the posterior branch supplies the posterior deltoid and the teres minor. It also gives rise to the superior lateral cutaneous nerve of the arm, which provides sensory innervation to the skin over the inferior lateral shoulder. In summary, the axillary nerve supplies motor innervation to the deltoid and teres minor muscles and sensory innervation to the skin over the lower deltoid and upper lateral arm. The dorsal scapular nerve. The dorsal scapular nerve arises from the anterior ramus of the C5 spinal nerve. After branching from the brachial plexus, it pierces the middle scalene muscle and travels posteriorly, coursing deep to the levator scapulae and then continuing deep to the rhomboid minor and major along the medial border of the scapula. It innervates the levator scapulae, rhomboid minor, and rhomboid major, and carries no sensory fibers. Pectoral nerve. The lateral pectoral nerve arises from the lateral cord of the brachial plexus with root contributions from C5, C6, and C7. Soon after arising from the lateral cord, the lateral pectoral nerve gives off a communicating branch to the medial pectoral nerve, forming the ansa pectoralis. From there, it courses anteriorly over the axillary artery and pierces the clavipectoral fascia to reach the pectoral region. It primarily supplies motor innervation to the pectoralis major muscle. In many cases, it communicates with the medial pectoral nerve through the ansa pectoralis, which may allow indirect innervation of the pectoralis minor, as well as the inferior portion of the sternocostal head of the pectoralis major. In summary, the lateral pectoral nerve originates from the lateral cord, C5 to C7. It provides motor innervation to the pectoralis major and may indirectly supply the pectoralis minor via communicating branches with no sensory component. Long thoracic nerve. The long thoracic nerve originates from the roots of the brachial plexus, with contributions from C5, C6, and C7. It descends posterior to the brachial plexus and anterior to the scalenus posterior muscle. Then continues along the chest wall in the mid-axillary line on the superficial surface of the serratus anterior. It provides motor innervation to the serratus anterior muscle through multiple branches that enter along its slips. In summary, the long thoracic nerve provides motor innervation to the serratus anterior and carries no sensory fibers.